We now come to the ministerial statement. Secretary of State for Health and Social Care. Secretary of State.
Thank you, Mr. Speaker. With permission, I'd like to inform the House about the outbreak of a new coronavirus in China and the UK's response to protect the British public. As of this morning, there have been 571 cases confirmed by the Chinese government, and 17 people are reported to have died of this new strain of respiratory illness. All the fatalities have so far been contained to mainland China. However, this is a rapidly developing situation, and the number of deaths and the number of cases is likely to be higher than those that have been confirmed so far, and I expect them to rise further. It has been reported that the Chinese authorities have placed further transport restrictions on the epicentre of the outbreak in Wuhan city, including on international flights. A small number of cases of the new coronavirus have now been detected in other countries, including Thailand, Japan, South Korea, Taiwan, and the United States. Experts at the World Health Organization are meeting again today to determine whether this new outbreak now constitutes a public health emergency of international concern. Mr. Speaker, most cases of the new coronavirus so far have been non-fatal. In these cases, most people experience cold and flu-like symptoms and then recover. However, there have been a small number of cases so far where it's proven more serious and fatal. There are no confirmed cases of this new infection in the UK so far. We've been closely monitoring the situation in Wuhan and have put in place proportionate precautionary measures. Our approach at all times has been guided by the advice of the Chief Medical Officer, Professor Chris Whitty. Since yesterday, Public Health England officials have been carrying out enhanced monitoring of direct flights from Wuhan City, and all passengers on direct flights from China will receive information on what to do if they fall ill. Professor Whitty and Public Health England, aided by international experts, are in close contact with their international counterparts and are continually monitoring the scientific evidence as it emerges. The Chief Medical Officer has revised the risk to the UK population from very low to low, and has concluded that while there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them. The UK is one of the first countries to have developed a world-leading test for the new coronavirus. The NHS is ready to respond appropriately to any cases that emerge. Clinicians both in primary and secondary care have already received advice covering initial detection and investigation of possible cases, infection prevention and control, and clinical diagnostics. Acting on the advice of Professor Whitty, we have updated our travel guidance to British citizens to advise against all but essential travel to Wuhan City. We are working closely with our counterparts in the devolved administrations, and the public can be assured that the whole of the UK is always well prepared for these types of outbreaks, and will remain vigilant and keep our response under constant review in the light of emerging scientific evidence. And I commend the statement to the House.
Thank you, Mr. Speaker. And I thank the Secretary of State for an advance copy of his statement and for updating the House this morning. The coronavirus is indeed very concerning, and I'm grateful for Public Health England and the Department's work on this so far, especially screening passengers on direct flights from Wuhan. However, a passenger arriving from Wuhan yesterday said that he had gone through virtually no screening at all, but was given a leaflet. So does the Secretary of State have any response to that? Will flights from other Chinese cities, not just Wuhan, be monitored, and when does the Secretary of State think monitoring might begin? Will there be specific traveller advice for UK citizens travelling into China who have existing conditions that may mean they need to take more care? Public Health England have assessed the risk of the coronavirus being spread to the UK as low, as he said, and in the event of the virus spreading to the UK, is there contingency plans and funds to prevent further spreading to deal with the scale of the problem? We are in the middle of the flu season, as he will know, so I do not want to cause any undue anxiety, especially as there are no cases, as we've heard, in the UK at the moment. But can the Minister please advise people watching who may be concerned about their own symptoms what they should do? We all know that the NHS has a tremendous record in responding to similar incidents, such as Ebola and monkeypox. We can certainly be proud of our public health record in these areas and can be confident in how those bodies will respond to this incident. There is a chance that a global pandemic can be avoided if governments across the world take the right measures in a timely fashion. So I thank the Minister for his update today and would be grateful if he could provide some further clarity on the points I've raised. Thank you.
Secretary of State.
Thank you very much, and I appreciate the cross-party approach that's being taken to this outbreak and the remarks that the Shadow Minister made, specifically on the points that she raised. On the reports from the flight that arrived yesterday, it's important that we get the enhanced monitoring right, and the challenge here is that symptoms for the Wuhan novel coronavirus do not usually appear until 5 to 7 days and sometimes up to 14 days, and therefore the advice is that the most important part of the monitoring is to ensure that everybody knows what to do if the symptoms arise, because often the symptoms won't be there for somebody on the flight. Having said that, we do not expect further flights from Wuhan because the Chinese authorities have taken steps to stop travel out of the city. She asked whether we'll be monitoring flights from other Chinese cities or indeed from anywhere else. Currently, the evidence suggests that the vast majority of cases are in Wuhan. Obviously, we keep that under constant review, and we will not hesitate to take further steps if that's necessary to protect the British public.
Robert Halfon.
Thank you, Mr. Speaker. In Harlow, we have a big and vibrant Chinese community and a very large Chinese community centre. Could I ask him what information is being sent to Chinese community centres like the one we have in Harlow? And many of the members of the Chinese community have relatives in Hong Kong. Could I ask him to give an update on what is being done in terms of if this flu disease reaches Hong Kong?
Secretary of State.
Well, thank you. There is evidence of potential cases of the coronavirus in Hong Kong, although, as I say, the vast majority of cases are in Wuhan City. We'll keep that under review. The advice to his Chinese residents is exactly the same as to all, which is to avoid anything but essential travel to Wuhan City, and that the direct flights from Wuhan City appear to have been ceased. I would also say, of course, that Harlow is has an awful lot of people in it already, and more to come, who work for Public Health England, and I'm sure he'd want to join me in thanking them for the vigilant work that they're undertaking.
Anne McLaughlin.
Thank you, Mr. Speaker. It's obvious that the scale of the operation at hand here shouldn't be underestimated. Shutting down a city the size of London as it prepares to celebrate Chinese New Year is an extraordinary undertaking. Can I ask what support he's aware of that's been offered to the Chinese authorities from the international community, in particular to the health services, as they cope with this unprecedented strain on resources? Some of my questions have already been asked, so I'll just ask about the World Health Organization meeting today. What communication does the UK Government have with them, and can he assure the House that the Government will remain updated in real time on developments and what steps, if any, are required in the UK? And finally, I have a number of constituents, as we probably all will have, Chinese constituents, and many of them English is difficult. So when we're talking about giving information to Chinese communities within the UK, is it being done in different languages?
Yes, on the point on languages, the advice will be available today in Mandarin and Cantonese. The UK is heavily engaged in the WHO response. And in response to her first question on engagement with the Chinese government, Of course, we're engaging with the Chinese government. Principally, this happens through the World Health Organization, who have very well established procedures to make sure we understand the nature of the outbreak, that the scientists can investigate the epidemiology and come to an evolving scientific analysis of what's happening, and then we base our decisions as much as is possible on the scientific advice that flows from that. The person coordinating that here in the UK is the Chief Medical Officer, who is an expert in these issues.
Jason McCarthy.
Thank you, Mr. Speaker. Many UK universities, not least my local Huddersfield University, have strong links with the Wuhan University of Technology and Science. What particular advice is the Secretary of State's department giving to UK universities, particularly those with large Chinese student populations?
Secretary of State.
Well, we're not giving specific advice. We're giving the same advice to everybody, which is avoid all non-essential travel to Wuhan. But I'm very happy to take away the point that we will ensure that we're communicating through Universities UK with all UK universities to make sure that the message gets to students directly, and they hear the advice that is there for everybody, which is to avoid all but essential travel.
Afzal Khan.
Thank you, Mr. Speaker. My thoughts go out to all the residents of Wuhan, Manchester's sister city. Sadly, the news of this outbreak couldn't have come at a worse time as residents prepare to celebrate the Lunar New Year. Can the Secretary of State tell us what further things he can do in light of our expertise in this disease, particularly what you said about coronaviruses, that we can provide to the Chinese government? And also, I think we should provide more assistance to the people who are here. Like in Manchester, we have a sizable Chinese community, again, bringing more awareness.
Secretary of State.
Well, I'll ensure that the authorities in Manchester are fully appraised and kept up to date with our advice, which, as I say, is based on the best scientific evidence, to make sure that Manchester and its sister city deal with this as well as they can, as appropriately as they can.
Alicia.
Thank you, Mr. Speaker. Thank you, my right honourable friend, for the comprehensive update and particularly the detail on the tests the UK has developed for the coronavirus. Can I ask what consular assistance is being provided to British nationals caught up in affected areas in China and other areas?
Secretary of State.
It's a very important question. There are approximately 11 million people in Wuhan City, including British nationals. As far as we know, we have 2 UK staff in our consulate in Wuhan and 15 locally employed staff. Of course, we're ensuring they get all the support they need, and they are available to provide consular assistance to British nationals who are in Wuhan City.
Hilary Benn.
Thank you very much, Mr. Speaker. The House appreciates the fact that the Secretary of State has come so promptly to make this statement. In the event of an outbreak here, which of course we all hope does not happen, could he just tell the House what is the current advice to members of the public about the use of face masks? Because one of the things about these outbreaks is people look at what measures are being taken and what people are doing in countries where the disease has taken hold, and then ask the authorities here, well, why aren't we doing the same? And it would be helpful to know in anticipation. Presumably this will be guidance given by the Chief Medical Officer.
Secretary of State.
Well, that's right, and we have well-established procedures for dealing with a potential outbreak like this, whether it's flu or a coronavirus like this one. Our advice at the moment to the UK public is that the risk is low. Of course, we'll keep that under review. We try very much only to put forward proposals which are clinically appropriate, and the wearing of face masks is not deemed clinically necessary now. Of course, we keep that under review and will be guided by the science.
Lanera Wilson.
Thank you, Mr. Speaker, and thank you for the comprehensive update to the Secretary of State. We know that scientists are already working very hard to find a vaccine for this newly identified strain of coronavirus. And given the importance of vaccines in combating serious diseases, potentially such as this, would the Secretary of State agree that education about vaccines is more important than ever in this age of disinformation? And what conversations has he had with colleagues to combat fake news on vaccines?
The Honourable Lady makes an incredibly important point on which I wholly concur in the round, that vaccines are incredibly important and valuable, and we have a long-established process for working out where we should vaccinate. In this case, because the nature of the virus, it's unlikely that a vaccine is going to be available. There isn't one now. And so that isn't the route that we should be looking at, but of course we'll keep that under review. But the general point that she makes, which is that when advised to take a vaccine, like the flu vaccine for the winter, or like MMR for children, then people should vaccinate, because it's both good for you and good for your neighbour.